This is a Beggy Sisa podcast.
We can't change. We've got a law called National Health Insurance Act of 2023. It's a law. I'm sure, Mayor, you are not saying that we must sit back now and change the law through bilateral discussions between government and BUSA.
We won't participate in the compact process. We're not a signatory to it. That doesn't mean that we don't look for ways and means of working with government to make a difference to the healthcare system in our country.
Welcome to this edition of Beggy Sisa's podcast. I'm Mia Malan. The National Health Insurance is one of the most contentious issues in our government of national unity. Only 4 out of the 10 governing parties support it. But in August, Health Minister Aaron Motsoaledi told Beggy Sisa he's not prepared to negotiate, especially not on the section of the NHI Act that says medical aids in their current form will become illegal.
I never told anybody that I'm going to do consultation. I don't know where that comes from. Consultation for what?
The NHI is equally controversial among health workers and the business community. So much so that the country's largest federation of business organizations, Business Unity South Africa, and the South African Medical Association, which represents 12,000 doctors, refused to sign the country's second presidential health compact in August. The compact is a document which assigns specific tasks to signatories to improve the country's health system. The representatives of both BUSA and SAMA originally served on the steering committee of the second compact, chairing 2 of the 10 pillars of the agreement. As a result of Beggy Sisa's interview with Motsoaledi, 4 political op-eds were published by mainstream media houses, and dozens of radio and TV interviews followed, which helped to pressurize the government to consult with business partners. By mid-September, BUSA announced it had met with President Cyril Ramaphosa, Motsoaledi, and his deputy, Joe Pagla. By the end of October, BUSA will submit a proposal to the president with solutions to their concerns. But Ramaphosa's special advisor on social policy and also the coordinator of the compact, Olive Shisana, says BUSA will have to accept the NHI Act as is if they'd like to be part of the compact.
Now, this time around, what we are missing from it is BUSA and the South African Medical Association. Let me put it this way. BUSA's input into the summit, which is Pillar 4 of the summit, and input into Pillar 6 is there. If you look inside the compact itself, that copy of the compact includes a BUSA representative. And that representative was Stavros Nikolai, who spoke at the summit on behalf of BUSA. So they are disagreeing with the word NHI. That is their disagreement. Their members, BHF, has already gone to the courts and launched a case against NHI. And I think the reason they didn't sign was because it would undermine their case in court.
But Professor Shoshana, just to interrupt you here, I have a copy of the document that was signed. And if you sign this document, it does imply that you endorse the NHI. And BUSA doesn't feel comfortable endorsing the NHI in its current form. So if they sign it, they would essentially say they endorse it. And that's what they're unhappy about. And they say they weren't consulted about how the NHI was portrayed in this document. Before the draft document was distributed, did they have input into how this document was drafted?
They saw the full document. That full document was prepared since I think the last draft that was sent to everybody was April.
But then they complained about it and they said they want more input into it. Was there any consultation with them then between the draft document that was circulated and the signing?
Well, we sent it to everybody who wanted to look at it. They were the ones only who did not respond positively because they said NHI was included. And we couldn't understand because the summit itself, the theme was on NHI. The objectives that were there were on NHI. The pledge that was there was on NHI, which everybody who was in that meeting was saying actively support the National Health Insurance Bill and foster a culture of accountability as a rational means of attaining universal health coverage in South Africa. There was no objection. They were part and parcel of that in 2023 when we actually had the summit itself.
So the broader business sector now wasn't part of the second presidential health compact because that is who BUSA would be representing, the 48 organizations, right? What does that mean for cooperation in a structured way to improve the health system in South Africa? Would there now be less cooperation?
No. They still will be able to be part and parcel of the health system because, let me tell you, the NHI, when it is implemented, it will allow individuals to get services both from the public and private sector.
I hear what you're saying, that both the private and public health sectors would be part of the NHI. But I want to talk about cooperation to improve the health sector. So not the NHI, the compact, the fact that it is a document that assigns responsibilities to different sectors, including business, as to what they can do to help improve the health sector. Now, the fact that BUSA hasn't signed and 48 organizations that they represented are not part of the compact, responsibilities can't really be assigned to them. How do you feel about that?
Well, I'm hopeful that they will come back and sit at the table because the place where we sort out our differences for all these 5 years before and the next 5 years coming is in the presidential health compact discussions. That's where we meet and have a conversation.
Now, just to get back to the issues of how to resolve this conflict, if I look at the document that was signed, it does imply that if you sign it, that you endorse the NHI. Now, they don't endorse the NHI, even if you feel they didn't raise their voices. So how can you reach an agreement for them to be comfortable signing this document? Would you consider changing the wording, for instance?
I can't change the document that we sign because we believe in NHI. Everybody, the majority of the people that were in the meeting believe in NHI. So why should the views of the majority be subservient to the views of only one organization or two organizations?
What would the compromise be to get them to buy in then?
First of all, they've decided to take, not BUSA itself, but the Board of Healthcare Funders has decided to take up the case to court, and the court will decide. We live in a democracy. We can't change. We've got a law called the National Health Insurance Act of 2023. And that particular act, it's a law. I'm sure, Mayor, you are not saying that we must sit back now and change the law through bilateral discussions between government and BUSA.
I think what they also saying is that when the second presidential health summit happened, the NHI was not law yet. So they felt it was something that was in the future that they clearly were hoping wouldn't become law. But now it's law, and I hear you can't just change a law. But where would the solution be? How would you then get their buy-in?
They had come in as friends of NHI, putting their logos to say NHI. That's where I don't understand. That's where I get confused in terms of what BUSA stands for. What do they stand for?
So do I hear you correctly? You're saying either they buy into the NHI or they don't. But if they don't buy into it, then so be it.
Well, NHI is going to continue. And it's not unusual, by the way. The British, when they introduced their NHS, they had similar problems. They had doctors refusing to sign up on it. It's a matter of transformation that we're dealing with here. We're transforming a system that is unequal and have a system that ensures everyone has the right to access quality healthcare from the resources available in the country, public or private.
Gus Kuvadia is BUSA's CEO. He disagrees with Olive Shisana that the NHI in its current form is set in stone. He says he's encouraged by the meeting BUSA had with President Cyril Ramaphosa in mid-September, and his team would now like to look at what the possibilities are to use the NHI Act in a different form to make it easier for the private and public sector to work together to give everyone in the country access to good healthcare. By the end of October, the President and Health Minister would have received their proposal. I asked Kuvadia what kind of changes BUSA would like to see in the NHI Act.
It talks about the state actually taking responsibility for healthcare for everybody in this country through a single fund. We believe that that's not the route to go. That's not utilizing optimally the resources we have in this country, both the public and private sector.
When you say there shouldn't be a single fund, are you implying that we should use private medical aids as well to give universal access?
Absolutely.
And what would that look like, giving more people access?
Well, that's what I'm not going to go into detail publicly. Those are the discussions we need to have with the President.
To get back to the compact document, to be fair, the first document did make it quite clear that all these efforts of building the country's health system and improving it was to implement the NHI, although the NHI was not law yet then. So in the second document, those references were different. It was already an act. I'm trying to understand your level of surprise in the second document that the NHI was mentioned so prominently within the context that in the first document, it wasn't mentioned as frequently and was mentioned as something that would happen in the future, but it made it very clear these efforts are in preparation for the NHI.
At that time, the NHI was still under discussion. We had made lots of submissions related to that. The NHI was not settled. There was no NHI Act. After the President signed the NHI Act, and we publicly have expressed our concerns about the Act in its current form, knowing that we have the reservations, knowing full well that that's the state of affairs, to use the health compact to try and force through a piece of legislation that they know is problematic to critical players in the sector is totally unacceptable. It's disingenuous. The compact is supposed to be something that signatories agree to. We never agreed to that.
Olive Shisana says you didn't raise any concerns at the summit in 2023 in preparation for the compact. Is that correct?
No, it's not. We raised issues. People like Stavros Nicola and others who were representing us raised issues, and Stavros is absolutely clear that those issues were not taken into account.
Professor Shisana says BUSA wrote Pillar 4 of the longer document of the Health Compact. Is that correct? It is the private sector involvement, Pillar 4.
I'm not too sure we wrote it. I have no doubt that we gave substantial input into it. We wouldn't have written it and expected to have what we've written taken into the compact without any discussion. So I have no doubt that we played a critical role in crafting it, but we didn't write it.
Olive Shisana says the real reason why you don't want to sign the Act is because of the court action of the Board for Healthcare Funders. And she believes they are a member of BUSA. Is that correct?
Yeah, that's correct, but that's not the reason why we haven't signed the compact. A number of organizations are talking to attorneys about possible legal action on the NHI Act. For us, the NHI Act and the compact should never have been confused, to be quite honest. We didn't discuss the compact at all in our discussions on what our approach is to the NHI Act after it was signed. Not once did we discuss the compact. So to say that we didn't sign the compact because the Board of Healthcare Funders or anybody else for that matter is considering legal action, it's just not correct. I don't know if she's got information elsewhere, but I am involved in these discussions. It's just not correct.
So the fact that you haven't signed, what are the implications of that? Because essentially the compact is a formal way or structured way for everyone to work together to improve the health system. What does that mean for your participation in that process?
Well, we won't participate in the compact process. We're not a signatory to it. That doesn't mean that we don't look for ways and means of working with government to make a difference to the healthcare system in our country. The compact is not the only instrument through which we can do that. In our normal ongoing engagement with government, if we find each other on things and we find that we can work in partnership to make a difference as we are doing in energy, logistics and law and order, we'll do that.
If you had to say in a nutshell in the previous compact, what was your contribution? What do you think was the most meaningful part of it?
Well, I think we worked together to address issues in the compact. We raised money where we needed to raise money. We brought members to the party, particularly in the healthcare sector, to achieve certain things. We mobilized resources and capacity where they was appropriate. And that's what we would have done under this health compact.
So if your consultation doesn't result in anything, if there is no compromise of any sort, will court action then be the next avenue?
Well, we made it very clear that court action is definitely on the agenda. If our engagement doesn't lead to anything, then we will regroup and look at our next steps.
That was Business South Africa's CEO, Kas Kuvadia, talking about the business sector's concerns about the NHI Act in its current form. We'll be publishing our analysis of the contents of the second Presidential Health Compact in October, so later this month. It's a document of over 100 pages, so do keep an eye on our website and social media channels if you'd like to read it. Until next time, I'm Mia Malan. Goodbye.
This was a Peggy Sisa podcast.